The Heroes of Infection Prevention Award honors infection preventionists who have successfully reduced infection, raised awareness, and improved the health and well-being of patients, healthcare workers, and the public. Supported by a grant from BD, an APIC strategic partner, the program has recognized more than 100 individuals and groups for their exceptional work in reducing healthcare-associated infections. It is an honor to recognize the following as 2016 Heroes of Infection Prevention. Kelly Boston. Through motivation and education, Kelly integrated the infection prevention teams across one of the largest health systems in America to dramatically reduce infection rates. After creating a centralized infection prevention reporting structure, Boston established formal education and advancement plans to help support and grow the infection prevention leaders she saw within each hospital.
She did education, she did competencies for infection preventionists in her system, and that's critical. Clearly, she worked very closely with administration and got their buy-in, and as a result was able to have significant reductions in her healthcare-associated infection. And, that's what we're looking for. That's what we're out there to do.
Our next Heroes Award goes to Shannon Davila. Shannon's ability to motivate and engage people in the hospital environment has enabled her to positively impact infection rates across an entire state. As the New Jersey Hospital Association's Clinical Quality Improvement Manager, Davila provided support to New Jersey hospitals on national and statewide quality improvement initiatives. During her 4 years with the NJHA, Davila helped state hospitals integrate several initiatives which led to an impressive 31% reduction in CAUTI rates statewide, among other successes. Now a clinical content development lead at the Health Research and Educational Trust of the American Hospital Association, Davila is engaging individuals nationwide to improve infection prevention practices.
I had worked with Shannon closely, and she is a go-getter. She has that drive, she has that energy, and she leads multiple programs in the state. So she is really out there engaging the hospital members, the IPs, everyone, the leadership and everything like that.
Our next Heroes Award goes to Chaz Roan. Chaz Roan's efforts to reduce catheter-associated urinary tract infections at Tampa General Hospital demonstrate how championing a patient safety culture can generate significant results. Chaz worked to position himself as a leader and resource, interacting with physicians and nurses to provide educational materials, gain buy-in, and solicit feedback.
We were very impressed looking at Chaz's application. He was able to use the electronic medical record in a very positive way to put out a best practice alert so that if a patient had a catheter, a daily alert would come up asking the staff to reassess the necessity for that catheter. To be doing the work he's doing as a relatively young infection preventionist, a relatively new member of APIC, is very, very impressive.
Our next Heroes Award goes to John Fall. When John was offered the infection prevention and control position at Doctors Medical Center in 1975, he was an intensive care unit nurse with no formal IPC training. Despite being excited about the change, he faced the daunting task of building his hospital's IPC program from scratch. Over time, his common sense approach, along with the integration of tracking software, enabled Fall and his team to dramatically reduce their facility's infection rates.
John has had some remarkable outcomes in that he went long periods of time without having a central line infection in his NICU. And the impressive thing is that not only was he able to bring it down to 0, but he kept it there for 5 years. And that is truly remarkable outcomes.
Our next Heroes Award goes to Sara Lopez. During Sara's career as an IP, she has dramatically raised the infection prevention and control standards in her rehabilitation facility by bringing a sense of teamwork and fun to IPC programs. Her efforts at Health South Desert Canyon have resulted in a 0 catheter-associated urinary tract infection rate since June 2015, as well as 0 central line-associated bloodstream infections since July 2014.
She is a new one to the field. For her to be able to do that, she really had that energy, that got to do it. She made sure that leadership understood what is the prevention of infection means to their organization. To be engaging, making sure the leadership is listening to her to make things happen is really a great achievement for her, great job for her.
Our next Heroes Award goes to Suliman AlJamal and Irene Barron. In 2013, the senior leadership at King Faisal Hospital recognized that their infection control program was operating far below its potential due to lack of structure, staff, and consistency. Early the next year, they charged AlJamal, who soon appointed Barron to partner with him, with restructuring and reinvigorating the department to make it more effective and more efficient. The pair and the team they have assembled have generated impressive results in a very short time.
This partnership is really working for them. Suliman and Irene did that in many ways in improving the overall infection program, not only in their hospital, but in the whole region of where they are.
We salute our heroes and thank them for their innovative patient safety work.